Welcome back to Morning Line on this Wednesday. Nick Barris along with Clint Kelly, malpractice attorney. If you want to join in the conversation, really, give us a call. Don't be afraid. He doesn't bite. 737-7587 is the number if you want to join us. Questions about a case maybe, something experience you had with a doctor or a hospital. You wonder if you possibly were done wrong. Let's go to Charles next. Charles, good morning.
Good morning.
Hi, Charles. How can we help you?
Well, a couple of years ago, I was seeing a private practitioner for a mental disability, and he wasn't prescribing enough medication, so he ended up being kicked out of school, kicked out of the house, homeless, hospitalized, and incarcerated twice, because when you are medicated and homeless, you're 10 times more likely to go to jail than the hospital anyway. Do I have a recourse for my losses?
Wow. Yeah, and he's dealing more with, sounds like a mental situation, and well, you know, what do you think?
That's
in cases like that. I was going to say that's. We haven't had a call like that. Now, first of all, he said 2 years ago, so maybe statute of limitations. But what about that?
Yeah, I mean that's a tough case when you have to prove that someone failed to give the right medication. It led to all these other problems, and anytime you get into a mental or psychiatric problem as the result of it, that's where hospitals and doctors will just dig in their heels and fight it to the last breath. Because
it's hard, because I'm wondering though, do you believe there are psychiatrists that commit malpractice?
Absolutely.
Okay, proving that, how would you go about doing it? I mean,
your typical case that you would take is a case where someone is in the hospital and the psychiatrist discharges the patient prematurely, and that patient either commits suicide, either in the hospital or outside the hospital recently after a discharge. That's a classic case. Another case may be where a psychiatrist prescribes a certain drug that interacts with another drug and causes the patient a serious injury or death. Cases like this where you're withholding medication, it leads to certain complications in life, you know, like what Charles described. They're tough cases, Nick.
Yeah, I'm sorry to hear that for him, but I can see how that's a tough one to prove. Yeah. Thank you for your call, Charles. I wish we had a better answer for you, but it's just a tough thing to prove. Let's go to Rod. Rod, good morning.
Good morning. I just woke up, so if I get the sun, excuse me.
That's all right.
My wife was fell at work a week ago Monday.
Okay.
Well, she broke her hip and her wrist in 2 places. And, of course, they carried her to the emergency room, did the surgery and everything. Then the doctor wanted to send her to rehab. And Workman's Comp refused to do it for like 4 days until yesterday evening when she finally got in there. And I'm hearing bad things about workers' comp in Tennessee.
Oh, so you're wondering just about whether
am I right? I mean,
that it took that long for them to get. But you're saying she fell just last week?
Yes, and
it took what, like about 5-6 days to get workers' comp to clear you for the rehab?
Yeah, and what they said they wasn't going to. Now she's got regular insurance too.
Okay.
Yeah.
Well,
I'm just wondering what my rights are.
Yeah.
But I'm kind of being told there really ain't much I can do under, Workman's Comp in Tennessee.
Rod, there's an attorney named Donald Zuccarello who's a good workers' comp attorney here in Nashville, and that's who I would call. I'd call Don and ask him what are your rights under the circumstances, what can he do for you, because clearly you got a work comp issue. You're right, your health insurance will pay for medical expenses that aren't paid by workers' comp, but if this is a comp-related issue, then workers' comp should be paying for all of these expenses as well as time off from work that have been sustained and will be sustained. That's what I do. You need to call a good work comp lawyer.
Yeah, which is, kind of, I hope your wife gets better, but yeah, if there's questions about that, there's people who specialize in that, right?
Yes, there are.
I hope that helps, Rod, rather. Thanks for the call. You know, I'm trying to think, some of the most common cases you see these days, has it changed? What are you talking, back injuries? Is it MRSA? Is it falls? What are you seeing right now?
Yeah, well, falls, I'm seeing
well, you said you see a spike in that.
A spike in falls. I've told you also that I'm seeing an increase in blood clots. Patients who have had blood clots either in the hospital or shortly out of the hospital where the patient dies as a result of what we call pulmonary embolism. That's just a blood clot in the lungs because they weren't given proper blood clot prevention treatment in the hospital. I'm also seeing a lot of medical batteries. I think I've told you about that, where patients are being operated on either on the wrong arm or the wrong leg or the wrong patient.
We know
we've covered that. And I know that's what I do, is rub my head and go, how does that happen? But it's happening. It's going to continue to happen.
Well, the big story that you and I did a couple months ago on the poor woman who was accidentally prescribed or given the wrong drugs, correct?
Correct.
That resonated with a lot of our viewers, because we all go and get prescriptions once in a while. And I guess, is that case still in flux right now? But yeah, remind folks the situation on this. She was supposed to get something for muscle relaxers or something like that, and she ends up getting an antipsychotic drug?
Right. She went to CVS Pharmacy and was attempting to refill a prescription for a muscle relaxer. The name of the drug starts with an R. And when she got the prescription filled, she got another drug in its place, an antipsychotic medication. But it was the same pill bottle, the same name, the same dosage on the bottle, so she didn't know it was any different.
Right.
When she opened up the bottle, they looked very similar to the pills she normally takes. She took those pills and had basically a seizure, hallucination, and wound up having to go to the emergency room. And all of us, we've talked about this, have generic drugs, and they sometimes change from one generic to another.
Yeah.
You count on the fact it's the same drug, and when it turns out not to be the same drug, you're shocked.
Yeah.
I mean, it's just something we take for granted, is when we go to the pharmacy, we're going to get the right drug.
Well, and that's one of the parts of the story where I was asking you, and how do you prevent this? You go and get a prescription. What do you do when you get your pills? I mean, we all trust. I mean, there's that, what's that pill book again that you always tell me about?
Physician's Desk Reference.
You've probably seen those, the Physician's Desk Reference. And there's pictures of the pills along with the description of what they do.
Right.
And I guess you could get the pill and compare it, but who compares and double checks? I guess what you would do maybe, and I think you said this to me, is you get your prescription and then try to say, could I just talk to the pharmacist briefly? I just want to confirm with you, this is what I'm getting. Can you look and make sure it's, just double check? Would you do that?
Yeah. Before what happened to Miss Duncan happened, I would have never thought to go to the pharmacist and ask the pharmacist, because, I've told you I take a medication where there are 2 different generic brands and the shape of the pill is different for each generic. I just assume it was the same drug. But since I now know what happened to Miss Duncan, if I look in a pill bottle and I see that it's a different looking pill, I'm going to go to the pharmacy and ask the pharmacist, is this the right stuff, before I take it.
Right.
Just not going to take that chance anymore, knowing what happened to her. Yeah,
that got a lot of people's attention. One other case I wanted to hit before we go to our break, and maybe we can talk more about this. If we get more calls, we'll take those as well. But the meningitis settlement, the compounding, that finally came down. And I don't know if there were statute of limitations. I don't think there were really, but that was a huge case, and there were people here. Remember, it was a contaminated compounding mixture, and it killed some people, right?
Right.
And I guess the settlement finally came down. I don't know what your thoughts were on how that played out.
One thing I do know is that there wasn't enough money, unfortunately.
Never is there? Yeah.
And that's really unfortunate for the victims of this. But that's one of those situations where the patient can't do anything, because you're totally at the mercy of the healthcare provider and the manufacturer of the compound to get that right. And if it's wrong, basically what's happening is you're having a poison injected into your body, and there's not anything you can do about it once it's in your system. And again, we count on pharmacists and drug manufacturers and now compounders to get it right, to make sure there are proper safety measures in place to prevent this very thing from happening. And
compounders, again, those are the folks that put together some of the vaccines or whatever it is you're getting, right? I mean, they're mixing it. It has to be obviously very sterile. They're supposed to be in lab settings. I remember reading about this lab. It was a joke how dirty it was.
Yeah.
And that's how it came. But that's the thing. We were just talking about pills. If I go get a shot, Clint, I'm not questioning whether or not that fluid in the syringe is real or not. I mean, what am I going to do there?
Well, nor should you, which is all the more reason why we have to have a strong court system in place
to hold these people accountable.
To hold them accountable, because if you don't have that, if we don't have a strong court system to hold people accountable, these things will continue to happen.
Right.
Because there are no consequences to it.
We see deregulation, at least now as it looks within the current administration. I see a look at maybe loosening restrictions on the FDA approving drugs. Now, I understand sometimes, and I've done stories, the FDA sometimes, I think, just is so slow, okay? And you see drugs that are effective that are being used overseas, okay? Effective ones. And you wonder, why the heck can't they get their act together on this one? But other times, they're there to protect us. Right, the FDA. I know there's politics involved in money, but what do you think of that, of loosening the restrictions in some ways so that the FDA can or is pushed to quicker approve certain drugs?
You know, Nick, I'll leave that up to the policymakers in terms of what they think is the best.
That's great. Leave it up to the politicians.
Well, I mean, but they have more information about that than I do. What I care about is that we have a strong court system so that if someone is injured as a result of deregulation, if someone happens to take pills that aren't tested properly enough on the front end, they can hold the drug manufacturer accountable and be compensated. Because there are times when the FDA needs to approve drugs faster to help people, and there are risks associated with that. I don't have a problem with that. What I have a problem with is when someone comes along and says, not only are we going to do that, but we're going to cut off your rights in court so that if you are injured in that situation, you can't hold someone accountable. That's where I get mad.
We'll talk more about tort reform as well, because that's exactly what happens in a lot of states, including here in Tennessee. We'll take a break. Hey, lines are open if you want to jump in. We've got one more segment with Clint Kelly taking your questions, talking about medical malpractice, 737-7587. And stay tuned at the end of the program. We'll have his contact information as well if you prefer to talk to him privately. We'll be back with more right after this.